What do you recommend to patients as good home care in order to maintain gum health?
So a lot of the time you have to pick and choose and kind of assess each individual to figure out what they are receptive to using. So I can recommend whatever I want. If the individual's not going to use it or use it effectively, it's not going to help. So in general, twice daily brushing, twice daily flossing is important, right? Whether you do it with a manual or an electric toothbrush, if you do it thoroughly and properly, you can achieve the same outcome. But if you use an electric toothbrush that has a built-in pressure sensor, for example, Oral-B or a Philips Sonicare toothbrush, you're going to be able to brush your teeth without scrubbing them and remove usually around anywhere between 5 to 7 times more plaque per unit time as you would with your own manual toothbrush. So most of the time, I do recommend using an electric toothbrush, and I do prefer the ones that are rechargeable with a built-in pressure sensor. With a toothbrush, it's important that you do brush for a full 2 minutes. And that's because in the first minute, you can remove 50% of the plaque and the bacteria. In the second minute, you can remove an additional 30%. So for a total of about 80% in the first 2 minutes. After that, you're not going to get much more improvement. So that's kind of where, all these electric toothbrushes are set to 2 minutes. And that's those are the studies on which they are based on. Flossing is important because floss is the only thing that can predictably get under the gum line in between the teeth. And if you don't floss, it's really like not brushing 40% of your tooth surfaces. If we look at periodontal disease, most periodontal disease occurs between the teeth, right? So flossing is very important. But there's many other tools that can be helpful. So there's certain individuals that due to manual dexterity, they can't floss, right? Or they have braces and it makes it very challenging. So certainly there's good adjuncts that are very helpful. Proxy brush or a water pick. They're very, very good adjuncts as well. In certain individuals, they can almost replace the flossing because the individual can't floss.
Better than nothing.
Absolutely, absolutely. And some studies have actually found that in individuals who have periodontal disease, the combination of flossing and a proxy brush or flossing and a water pick is really important. And that's what really makes the difference in the end in home care.
I don't know if you had a chance, but I know one of the electric toothbrushes has an actual app and Bluetooth technology that connects to the toothbrush.
The Philips Sonicare one.
I think they both do now, but it actually gives you live feedback about, how you're brushing and, where you're making tooth contact and so forth. I found that quite fast. Quite interesting for somebody who maybe wants to be a little bit more high tech with their oral health care.
That is fantastic for someone who loves technology, right? And I found teenagers, especially like my kids even love that. They are so motivated by it. It's fantastic. And, they're learning, and that feedback that they get while they're doing it is very important, right? Yeah. It's not everyone's favorite thing, but certainly if you do like technology, it's fabulous. It's fabulous. Yeah.
Well, especially with the newer generation, they're all over about gadgets and tech, right? So yes. I think it's probably geared towards them as well.
Oh,